good morning, everyone. Throughout the COVID-19 pandemic, especially when the Movement Control Order MCO took place, the community was indeed affected in terms of emotional and mental health. From 1st January 2021 until recently, the Psychosocial Support Helpline received more than 122,000 calls. Of the total, almost 90% were closely related to psychological issues impacting from various social problems, such as loss of source of employment and income, loss of place to depend on, fights between family members, marital problems, and emotional or physical abuse. Interestingly, spirituality is also among urgent concern by community in seeking help during pandemic. In terms of research, growing number of studies look at mental health and psychosocial impact of COVID-19 in Malaysia. Among those selected sample, university students were investigated the most, followed by healthcare workers and general community. On the other hand, in terms of emotion, anxiety was mostly investigated, followed by depression, stress, and suicidal variables. Most studies focus on negative emotion. However, Azam and colleagues did include happiness variable in their research. Other psychological aspects that have been focused were coping strategies, social support, quality of life, work-life balance, and physical activity. In terms of management and intervention, Ministry of Health Malaysia has coming out the SOP for psychosocial support service. However, looking at the models, it is hoped that the training is not about black and white, in which too many suggested ways of coping is just by channeling from negative to positive, and this could be harmful to the emotionally intense client. In this presentation, I would like to highlight Khayyum's paper on outlining the CBT strategies in managing the impact of COVID-19 by augmenting with mindfulness, self-compassion, and spirituality to adapt with the new or renew norms of long pandemic. Besides that, there's one another good study by Ko and colleague also recommended acceptance and commitment therapy, and the manual that they propose also quite extensive that include motivational interviewing and communication skills in order to be resilient in handling difficulties and uncertainty time during pandemic. With that, I'd like to recap. Evidence based on the effectiveness of CBT managing those affected population during pandemic is worth of investigation. Some examples of needed sample are children and adolescents, minority population, parents who work both from home and office while attending online classes with children, pre and post vaccination sample, and many more. Most important to revisit the Malaysian Psychosocial Support Service to understand the need to separate micro and macro level of intervention at both population-based and clinical practice strategies. With that, thank you for listening.